In this video, I'll be talking about a visual tool, BiteFX, and how I use this tool to help patients understand occlusal disease. I'll discuss my philosophy. I'll be discussing when and how I introduce occlusal concepts with the patient, either before an examination or after an examination. And then I'll show you situations where I'm working with actual patients and dealing with their problems and helping them understand their problems so they can make the best choice for themselves for long-term success using visual learning. And then I'll wrap it up and give you some pointers where you can get some more information. I think it's important we talk about all three aspects of the things we treat. As I see it, gum and bone disease and tooth disease is primarily up to the role of the patient. It has a lot to do with diet and habit, lifestyle, and general health. If we educate and motivate our patients to that extent, we've all seen patients that come into our dental offices, their mouths are so healthy they don't need our services. Let's say that a natural tooth in its healthy state is far better than our most sophisticated lab work. If we have to do dentistry, do the best dentistry possible, and if we can make that dentistry where it's built to last, I think that's fabulous. It minimizes our need to do repetitive restorative work, and it gives them the confidence to know that they're being treated by a health professional that can give them things that are designed to last if they do their job. I think occlusal disease is our job. So I'd like to give you an overview of my examination approach. Occlusion. When a patient comes in my office, it's one of the first things I discuss usually, and they tell us what their chief concern is. What I try to do is find out what they want and give it to them. Often I'll conduct a pre-treatment interview where I discuss what their fears are, what their past experiences have been, what their goals are. I might say something like, "Mary, we're glad you're here. We want to know what your concerns are. We want to know what your long-term goals are, what your experiences have been, what your fears are. But mostly we want to conduct a very thorough examination today. And we're going to look at several things. We're going to look at your teeth. We're going to check for tooth disease, tooth decay, maybe cracked teeth, fractured teeth. We're going to check your gums to make sure they're not bleeding. We're going to check the bone around the gums to make sure that it's there and it's not going away. We'll do a cancer exam, and we're going to check your bite. I conduct a thorough examination that looks at all the diseases. The final part of our examination is examining the condition of the teeth and the restorations using a dental operating room microscope under high power. We sit down with our patient and we discuss what we found. We help them see the things that could cause them harm, the things that could get in the way of them achieving their goals. I've never found a patient that wants to lose their teeth. Most of them want to be successful. We work to achieve success. So one of the challenges for me and for you is to present a disease that patients aren't aware of and often don't have any symptoms. I found, and as you'll see in this video, patients have increased, instant, remarkable understanding of occlusion. It's helped me get over the fear of presenting occlusion. It's helped me get treatment acceptance. I know it can help you get treatment acceptance. So you might be asking, when do I use BiteFX? Sometimes I use BiteFX before I examine a patient. If a patient's filled out an information form and it says that their muscles are sore, their teeth are grinding, I'll use BiteFX as a visual tool to help them see the type of examination I do, to help them see what constitutes bruxing three-dimensionally. Sometimes I don't use BiteFX. If a patient's healthy and stable, there's no occlusal disorders, there's no need to. Most of the time, I see occlusal disorders. I see wear, looseness, fracturing teeth, sore muscles. And I use BiteFX always at the post-examination interview.